Native American communities experience disproportionately high rates of alcoholism compared to the general U.S. population. Many outsiders falsely believe this is due to genetic predisposition or cultural weakness, but the real causes are far more complex. The issue is deeply rooted in historical trauma, systemic poverty, and government policies that have left Native communities struggling for generations. One major factor is historical trauma and forced assimilation. For centuries, Native peoples have endured land dispossession, genocide, boarding schools, and cultural erasure. These traumatic experiences have created lasting psychological wounds that have been passed down through generations. Studies show that communities with high levels of historical trauma often experience higher rates of substance abuse, depression, and mental health struggles. As Lakota psychologist Maria Yellowhorse Braveheart states, historical trauma doesn't just disappear. It manifests in cycles of grief and coping. Another major issue is poverty and lack of opportunity. Many Native communities face unemployment rates double or triple the national average, with limited access to well-paying jobs, quality healthcare, and addiction treatment programs. Economic hardship often leads to increased substance abuse as a way to cope with stress and hopelessness. Without proper resources, many Native people struggling with addiction are left without support or effective recovery options. U.S. government policies have also played a role in the alcohol crisis. During the 19th and 20th centuries, the federal government imposed alcohol bans on Native tribes while simultaneously allowing non-Native traders to profit from selling liquor to Native communities. Additionally, the reservation system and land restrictions have made it difficult for tribes to develop self-sustaining economies, leading to increased substance abuse as a coping mechanism. The lack of mental health and addiction services is another major barrier. Many reservations have limited access to rehab centers, therapy, and culturally sensitive recovery programs. The Indian Health Service, IS, the primary healthcare provider for many Native people, is underfunded and often lacks specialized addiction treatment programs. Without these resources, many individuals struggling with alcoholism have nowhere to turn for help. Despite these challenges, many Native communities are fighting back. Tribes are implementing culturally based recovery programs such as sweat lodge ceremonies, talking circles, and traditional healing practices to help individuals overcome addiction. Some communities have also imposed alcohol restrictions on reservations to reduce availability and prevent further harm. So, why is alcoholism so high among Native Americans? The answer lies in a long history of colonial violence, economic hardship, and lack of access to health care, not genetic predisposition. The real question is, how can Native communities get the resources and support they need to break these cycles of addiction and trauma? What do you think? Let's continue the conversation.